U.S. firearm injuries are at epidemic proportions. Over 100,000 people who are shot annually. Over 270 per day on average. Almost 40,000 people die each year from these firearm injuries, and no single policy or solution is going to solve it all. We call these policies that work.
These laws are really focused on intervening when people are making threats about what they're likely to do. This is a behavior-oriented type of intervention. It's not about mental illness.
They give police officers the clear legal authority to search for and remove firearms from a risky person at a risky time.
Over the past 6 years, a growing number of states in the District of Columbia have passed ERBO bills into law. That's incredible. Change is possible here in this country.
And this is the policy that works. The law is not being applied willy-nilly to everybody. It's being applied to a group of people who actually are at high risk of misusing a firearm.
There's a real opportunity to figure out through research how we can best implement these laws to assure that they have the maximum benefit on the public's health.
The majority of intimate partner homicides that involve more than one victim are committed with guns. Domestic violence restraining orders that carry firearm restrictions are incredibly important because they are initiated by the victim. We're seeing associated reductions with the total number of intimate partner homicides, suggesting that these laws save lives.
Background checks enjoy really broad public support. Consistently, they're supported by over 85% of U.S. adults. We have some new research that's forthcoming that found that purchaser licensing laws that had an in-person application and fingerprinting reduced the incidence of mass shootings by 56% and reduced the victims in these incidents by 57%.
I think anybody who studies mass shootings and the role of firearms will say that its ammo capacity is really the most critical feature here. So our estimate was these laws that ban large capacity magazines are associated with a 49% lower rate of fatal mass shootings.
By concentrating on those individuals who are at greatest risk for violence, victimization, or perpetration, communities can see potentially substantial reductions in gun violence.
I am a trauma surgeon, and the idea behind hospital-based violence intervention programs is to meet that patient at the bedside and begin to address that issue. At our trauma centers, when we see our patients, we have an opportunity, perhaps even an obligation, to offer something other than patching them up and sending them out again. If we're going to address violence, then we got to address those risk factors. This is a program that works, that actually saves lives.
New York, Oakland, and Los Angeles have each achieved impressive citywide reductions in gun violence by focusing resources to spur innovation and violence reduction approaches, especially those that are community-driven and community-approved.
It's been 60 or 70 years. We've been in this terrible spiral in our cities. That sort of disinvestment in resources has led to crime being committed in those neighborhoods. The first step, a city must have an anti-blight ordinance. Once you get a building fixed up, neighbors do not want it to return to the way it was. So they will go out of their way to informally police that space. This does not move crime around the corner. It actually reduces the commission of these acts.
So I think it's an exciting time in our country with regard to where the evidence has taken us and the opportunities for good policy.
The truth of the matter is that the most important policies that we're talking about, universal background checks, licensing, extreme risk protection order laws, all of them have incredibly high public support in both parties.
The proportion of money that goes towards research on gun violence is not sufficient or comparable to other public health epidemics. Funding from 2004 to 2014 was only $20 million. Congress should fund gun violence research at a level that is similar to other public health epidemics, such as the opioid overdose crisis, HIV, infectious disease.
We have real knowledge about what can save many lives. There is every reason to believe that with further investment, we can be, as a nation, on a trajectory for substantial improvement.
As our nation has this very intense debate over how best to make our communities safer and reduce the carnage that occurs from firearms, we've given you some policies that will work and how we can move this nation forward.